Hello all, my today's video is about Vamana Karma, that is about the Pradhana Karma of Panchakarma in children. As we are dealing with the Panchakarma in children topic, today's topic is about Pradhana Karma, which includes Vamana, Virechana, Vasti, Nasya and Rakta Mokshana. Okay, and in this Pradhana Karma, our Acharya Kashyapa added one more Pradhana Karma has a Panchakarma in children, procedure of Panchakarma in children, that is Dhupana, which we study as a Rakshogna Karma in pediatrics in Kaumara Bhritya. That Dhupana is also included in Panchakarma in children according to Acharya Kashyapa. Okay, so in these all 5 procedures, as we name Panchakarma, Vamana and Virechana are Samshodhana Karmas, means they are Rogaharam and promotes Bala, Varna and Ayush, which are those Vamana and Virechana. Whereas as we are dealing in children, so Virechana is not practiced usually in a children except in emergency conditions, like if there is very necessity of Virechana, then we will go for Mrudu Virechana in children, or else usually we will not advise Virechana in children. Instead, our Acharya Kashyapa explained in some context that wherever the Virechana is necessary, we can go for Vasti in children. Okay, wherever there is Virechana procedure we have to do, we can go for mild Vasti in children. And each of these procedures, like maybe Vamana, maybe Virechana, Vasti, Nasya, Rakta Mokshana, anything, any procedure, before going to the main procedure Pradhana Karma, what we have to do? We have to do the Purva Karma, that is Snehana and Svedana. For the detailed explanation of this Purva Karma, Snehana and Svedana, you can see my last video, that is Purva Karma video. I detailedly explained there that you have to do Snehana and Svedana priorly you have to do, then after that you have to go for Pradhana Karma like Vamana, Virechana, everything. But after Vamana Karma, if Virechana is to be induced continuously, then there should be gap of 15 days after following the Samsarjana Karmas. I think you all know what is Samsarjana Karma, right? Samsarjana Karma means the diet or the Ahara Vihara, whatever we follow after the Pradhana Karma for 7 days is known as Samsarjana Karma. Including that 15 days we have to give gap for the procedure to procedure, that is from Vamana. If we are going to give Virechana continuously, then you have to give 15 days gap between 2 procedures. But Acharya Kashyapa says that on 3rd day after Snehana, Vamana may be done, while Virechana is to be done after 4 days of Snehana. Explained by Kashyapa. So these all 5 Panchakarmas, one by one we will go detailedly explanations. So our first procedure is Vamana Karma, right? What is Vamana Karma? Here in this procedure we are eliminating the vitiated doshas from the Urdhva Bhaga of a person, means we will vomit the vitiated or elimination of doshas from the vomiting is known as Vamana. And especially here the Kaphahara, it is especially for Kapha disorders we will advise Vamana. And usually these Panchakarmas are mostly contraindicated in children, but in special conditions or emergency conditions we can go for Mrudu procedures in children, or else some Shodhana drugs are well prescribed in children. So despite the fact that we should contraindicate the Vamana Karma or Panchakarma in a children, we can have the plenty of references in classics that advise the Panchakarma procedures in children. But as our Acharya Kashyapa warns that Vamana is contraindicated below 6 years of age. In cases of Vamana being only option, Sadhyo Vamana we can advise. What is Sadhyo Vamana? Here you will advise Sadhya Snehana and Mrudu Vamana is indicated in a children in emergency conditions, that only Vamana is only the option for the treatment, then we can go for Sadhyo Vamana in a children. And in Ashtanga Hridaya Uttara Tantra, second chapter, they explained Vamana as Snigdha eva Sada Bala Kritakshira Nishevanat Sadyasthan Vamanam Tasmat Payemati Man Rudu. Means, prior to Vamana, before the Vamana procedure, the stomach of a baby should be filled with breast milk. In which conditions? In Kshirada and Kshira-Annada children, their stomach should be filled with breast milk. And in Annada children, the Lagu and Tanu Peya with ghee can be induced instead of Stanya. In Kshirada and Kshira-Annada, you can go for stomach full of milk, that is breast milk. But in Annada children, you should advise Lagu and Tanu Peya with ghee. You should advise to have stomach full before the Vamana procedure. And the ideal drug for the Vamana is Madanaphala, as it is opt for the Sukumaras. Madanaphala is the best drug of choice for the Vamana procedure. And in Kshirada and Kshira-Annada children, Madanaphala Pippali as well as Madana Pushpa can be used. Both this we can prepare the paste and we can apply for the breast of a mother, nipple of a mother, so that when baby sucks such a drug applied nipple, then automatically the baby will vomit the induced or intaken milk. But moreover, instead of Vamana Karma, as it gives the extra pressure for a baby to vomit the intaken food, so Kavala Dharana is more advisable in children instead of Vamana. Alternative for Vamana, we can advise Kavala Dharana in a children, especially for Kafahara property. Up to the extent, Kavala Dharana is the best procedure instead of Vamana in a children. But the only disadvantage is that Kavala Dharana is also advisable in after the 5 years of age. And especially before 5 years or 2 years, I think there is no need to Vamana Karma in a children, because as they usually vomits the intaken food, that is milk. Usually you can see babies, if they have the stomach full of feed, then immediately they will vomit the extra milk automatically without any force or without any extra pressure. So usually in Kshirada and Kshira-Annada, there is no need to have a Vamana Karma. After Kshira-Annada, in emergency conditions, we can go for Sadhyo Vamana, as explained in a shloka. Our next point is about the indications, drug used and management of Vamana. That is, in modern point it is known as emesis, right? Vamana is known as emesis. The main indications are Kafaja Roga, Medho Roga and Durgandha. Child who vomits milk frequently does not suffer from Kafaja Rogas, so does not require Vamana. As we said, the Vamana is the age duration for Vamana is after 6 years, right? As I explained in last slide, they are saying that as the baby vomits milk usually frequently, so the Kapha Rogas will not take vitiation in a, or vitiation of Kapha dosha will not take place in a children. So there is no need to have Vamana in a children. And Vamana when induced should be for both mother and children, because as the mother will be feeding the breast milk for the baby, so we need to advise Vamana for both mother and children, because if the vitiation of Kapha in a children is by breast milk vitiation, then there will be chances for treatment for mother also, right? So we should treat both mother and children. Usually do not require Snehana. If Snehana is given, induce vomit after 3 days. Why Snehana is not advised in children? Because they are Kapha Prakruti, right? So Snehana is not advised in a children. But if we want to advise Snehana, if baby is Ruksha, then we can go for 3 days Snehana. Then after 3 days we can go for the Vamana procedure. And especially the age advised for the Vamana is 4 to 8 months Sadhyo Vamana. but the main Vamana procedure purely is advised after 6 years. Only Sadhya Vamana we can go for 4 to 8 months, after 4 to 8 months of age. And the next point is drug used. As I said in last slide, Madanaphala is drug of choice for Vamana. But as in procedure, they will follow like 4 Anjali or more than that, a warm decoction of one leaves of Nichula, Katphala or Shirisha to be drunk with kalka of one of the drugs of Grahagni, Kritavedana, Vacha, Saindava, Pippali and Vatsaka, that is Kutaja or Madana Bija. Any of these leaves to be made a decoction of 4 Anjali and given to drink according to the digestion capacity of a person. Or Ratha Pushpa Kalka to be applied to a nipple or areola, and child is to be given for the breastfeed after 8 months. As we saw in the last slide, Madana Phala paste, Madana Pushpa, another one is Ratha Pushpa Kalka. This also can be applied for the nipple of a breast, so the baby will suck and get vomited. Next is procedure, how you will give this Vamana Karma, right? By sitting facing towards the east, and you should make the person to drink the decoction which I explained in a drug used decoction manner. And how much you should give? 2 Anjali, 3 Anjali and 4 Anjali according to their digestion capacity, that is Hina, Madhyama and Paramartha Matra. According to their digestion capacity, 3 types of digestion capacity, you should advise the decoction like 2 Anjali, 3 Anjali and 4 Anjali, and give Arishta after 5 to 6 Kala. Then induce vomiting by stimulating the pharynx with fingers. And you should make the person to sit little bent forward so that vomiting will come out easily. And do not try to control the Vamana Vegas, and do not take rest between Vamana Vegas. What you should advise? The person should not control the Vamana Vegas, and they should not take rest between the Vegas, Vamanas. And on previous day of Vamana Karma, you should advise the Kapha Vardaka Ahara that can be mild laxative. You should advise Kapha Vardaka Ahara before the procedure, before day. And how many Vegas you should get? Again, it depends on the digestive capacity of a person, right? Avara, Madhyama and Pravara. It depends on the digestion capacity of a person. This quantity, it is missed in a Kashyapa Samhita. They didn't give the quantities. Next point is management. Management means what all you should advise after the Vamana Karma for a person. What all you should advise? To sleep without air or fan, and to drink hot water, and to remove the residue kapha, that is the rest kapha to remove. You should advise to eat cooked rice with apamarga or pippali or shirisha. And for Trishna Rogas, you should advise to drink warm water with adraka, and take manda, no divaswapna, that is no day sleep, and follow the samsarjana krama. Strictly they should follow the samsarjana krama. But in case of atiyoga of shodhana, give ghee to drink or give anuvasana vasti with madura aushadha siddha taila. If there is atiyoga of the Vamana Karma, then you should go for ghee to drink. You should give the ghee to drink or give anuvasana vasti with madura aushadha siddha taila. You can advise. This was the management of a Vamana. Then our last point is results, right? It may be anything like your exams. There will be results for everything, right? It may be the procedure, it may be the exams, or it may be any conditions. The outcome will be in the form of results. Like that, for these procedures also there is result, but it depends on the 3 conditions. Like if we give correctly, then it will be Samyak Lakshanas. If we give in a mild form, that is mild form compared to the disease, then it will be Durvanta Lakshanas. And if we give more capability, more the dosage of capability of a tolerance of a person, then it will be Ativanta Lakshanas, right? So we will see what are the Lakshanas included in 3 stages. That is in Samyak Lakshana. Samyak Lakshana means if we give right way of the Vamana Karma, then there will be the Samyak Yoga. There is Rogopashanti or reduction in the complaints, and body becomes light and purified. Vomit should end with Pitta. In Samyak Lakshanas, how the vomit should end? It should end, the last Vega should end with the Pitta. Amashaya, Pakvashaya, Guda and Pitta are in normal conditions in Samyak Lakshana, and there is appetite. Appetite means Vata, Motra, Anlomata and Laguta will be in a person in Samyak Lakshanas. Whereas coming for Durvanta symptoms, there will be some conditions in a person like Virechana, heaviness in Amashya and Hridaya, Aruchi, Agnimandya, Admana, Atinidra, Alasya, Tandra, Shirograha, Sheetajvara, Sphota, Kota and Kandu. These all are the in cases of Durvanta Lakshanas. In cases of Ayoga, in Snigdha Purusha, repeat particularly Samshodhana Karma according to Charaka Sutrasthana. In Charaka Sutrasthana, what he explained, if there is Durvanta Lakshanas, that is Ayoga Lakshanas in a person, then Snigdha Purusha, if the Purusha is Snigdha Purusha, then repeat the particular Samshodhana Karma in a person or in a child. That is, the Vamana Karma should be repeated. Then next is Ativanta Lakshana. Ativanta Lakshana means Ati Yoga. If we give the more than the tolerant capacity, then there will be discomfort in all the strotas and weakness. There will be a weakness in a person, dehydration like Trisha, Moha, Murcha, Vata Prakopa, Nidra Nasha will be caused in a person. Difficulty to treat if vomits, Pitta, Rakta or Purisha. If he continuously vomits the Pitta or Rakta or Purisha, then there will be the emergency condition, but it will be difficult to treat such persons. These are the symptoms of Ativanta Lakshanas, means if there is Ati Yoga, excessive vomiting in a person after Vamana Karma, then these are the Lakshanas. So first of all, before advising the Vamana Karma or any procedure, you should see the Bala of a person. Bala means the tolerating capacity of a person and digestion capacity of a person. You should identify or diagnose correctly, then you can go for the procedure. Like has the Avara, Madhyama and Pravara procedures, you should advise according to their digestion capacity. So you will get. Okay, this was about the Vamana Karma, one of the procedure in a Pradhana Karma of Panchakarma in children. As we are dealing with the Panchakarma in children, I am going to explain one karma in one video. So my today's video was about the Vamana Karma, and in my next video we will see the Virechana Karma. And what is Vamana Karma? That is, Vamana means emesis, eliminating the vitiated kapha by the Urdhva Bhaga of a person, like by vomiting. Eliminating the doshas by vomiting, vitiated doshas by vomiting is known as Vamana. I hope you are getting my class or explanation. Thank you.